everyone. I'm very happy to be here with you today to discuss new topics of research about the EADV 2025 that happened in Paris this year. My name is Bastos, Pedro Mendes-Bastos, and I am a dermatologist based in Lisbon, Portugal. Besides being a clinician, I'm also principal investigator in clinical trials for immune-mediated skin diseases. So I would like to speak about two topics that I was able to discuss during this EADV meeting. The first one is the BTK pathway, Bruton's tyrosine kinase pathway. This is a new pathway in dermatology that is currently in clinical trials. And why do I think it's so interesting, this new BTK pathway? It's a new pharmacological target that's being studied for different skin diseases. The ones that are most advanced in their development program is chronic spontaneous urticaria and hidradenitis suppurativa. So we know that the BTK pathway is an intracellular pathway that can translate intracellularly what happens on the surface of many cells that have receptors connected to this BTK pathway. There are some studies addressing the BTK inhibition through pharmacological drugs, of course, in hidradenitis suppurativa, and that's what I would like to highlight. We have been treating hidradenitis suppurativa with biologics, and we know that biologics are a therapeutic strategy that focus on single cytokine blockade. And unfortunately, this strategy appears not to be as efficient as we needed for a certain percentage of patients. And so maybe we need to think again about HS pathogenesis. And what has been new about HS pathogenesis is that we now understand that there are a number of cellular elements that are relevant for this pathogenesis. So not only T cells, but also B cells, macrophages, neutrophils, fibroblasts, and even mast cells could be implicated. What is common about all these cells is that the BTK pathway is relevant for all these cells' activity in HS pathogenesis. So I am very excited to be on the verge of discovering how BTK inhibition could potentially lead to better outcomes for our patients. And this is something that we will learn more in the upcoming months and years. On the other hand, the second topic I would like to highlight is also a new mechanism of action that can have therapeutic implications for the dermatologist in clinical practice. And this is the OX40 ligand pathway. We have been hearing about drugs that target the OX40 ligand pathway, especially for the treatment of moderate to severe atopic dermatitis. This seems to be a new promising pathway, mainly for two reasons. The first one is that it targets the T cell, dendritic cell inhibition before naive T cells can differentiate and proliferate on the Th2 phenotype. And this is something interesting because if we can modulate this interaction and reduce the hyperactive proliferation of Th2 cells, we can impact AD pathogenesis in a positive way. And of course, lead to the reduction of the inflammation that eventually leads to the AD phenotype. On the other hand, and this might be the most exciting topic about OX40 ligand inhibition, is the possibility of interfering with the production of memory T cells that can eventually lead to the perpetuation and the trip between acute AD phases to chronic stages of the disease. And the fact that we can possibly reduce these memory T cell production by interfering with the OX40 ligand opens the possibility of disease modification and, eventually even curing atopic dermatitis. So the possibility of increasing intervals, the possibility of treatment remission is something we are considering now through this new therapeutic avenue. And so to sum my intervention here, I have discussed two new therapeutic approaches that could revolutionize the way we treat our patients with immune-mediated skin diseases, mostly the BTK pathway and also the OX40 ligand pathway. So thank you very much for your attention and have a good day.